Hi, my name's Phil. I like talking about politics, and in this video, I'm going to be talking with John Bosco Nwogbo, lead campaigner for We Own It, about their campaign to get as many parliamentary candidates as possible to sign up to 3 pledges related to the NHS in order to get discussions going about some of the systemic problems facing healthcare, particularly in England, as well as to raise awareness of the issues amongst future MPs for action in the next Parliament. Remember that many candidates may be well-meaning and they may well want to help improve the NHS. In fact, a large majority of MPs in the next Parliament will very genuinely want to turn the NHS around. I don't think their commitment will be in question. But if they haven't worked in the NHS and they haven't studied it in detail, how many will really understand the issues? So, in terms of the 3 pledges you'd ideally like as many candidates as possible to sign up for, the first one, we've got reinstate the Health Secretary's legal duty to provide healthcare to all. Now, can you explain exactly what that means, please?
Yeah, so a lot of people don't know that in 2012, when the Health and Social Care Act was passed in Parliament, that something fundamental changed about the NHS then. Before that, the Health Secretary had full responsibility to provide health services to people across England. Obviously, as many of your viewers will know, that duty is held by the health ministers in the different nations. And that duty was actually repealed in 2012 in England. And the effect of it is that healthcare is pretty much right now a postcode lottery. In effect, the quality of care you get now depends more than anything else. It now depends on how good your local NHS body is at managing their budget, right? So you may be in London and you get relatively good care, but if you live in Newcastle, you're getting horrible care because the kind of pressures in that area are heavier. And we think that the effect on the NHS is absolutely devastating. And it's time we went back to it. The Scottish and the Welsh never left the kind of original founding principle of the health secretary being legally responsible. And there was a time when you could sue the health secretary. There's actually a case where people in, I believe in Birmingham, sued the health secretary because they were on a waiting list too long because they had not provided resources to their local health authority. That's the kind of system that I think is going to put the pressure on politicians. So we think it's going to put the pressure on politicians to invest properly into the health service.
So it's essentially about, because I mean, we talked about this before it went live, and my concern with that is in terms of this legal duty to provide healthcare to all, which is what we need to move towards. At the moment, we don't have the capacity for that. I mean, we talked about mental health that so there's a lot of things within the NHS there simply isn't the capacity for. But what this pledge is about making someone centrally responsible so that if there's a particular region that's falling behind, they are legally responsible for dealing with that rather than just saying it's someone else's problem. So is that what this
Absolutely.
pledge is about? Yeah.
Absolutely, yes. And obviously, we're going to talk about the funding and the privatization
Mm,
element. And I think the funding element does speak to things like mental health,
yeah.
dentistry, um, yeah, and pretty much every aspect of the NHS that's currently being ignored by the
Yeah.
government. Yeah,
Yeah. So if we can move on to funding then. So the next one is about funding. And the point, that you'd certainly want to raise is the importance of funding healthcare is that if you've got especially workers, I mean, we need healthcare for all, but especially workers, if a worker is struggling with their health, whether it be physical health or mental health, and they're not getting treatment for it, they're not as productive and therefore the economy suffers. So ultimately, that is the need for making sure we're funding healthcare properly, yes?
yeah, absolutely.
Yeah.
So obviously, when we were speaking earlier on, you did kind of bring up, I think, a really interesting question about um, Health Foundation found we spend 40 billion pounds less per year
Hmm.
than a country like France or the average European country. We spend about 73 billion pounds less per year on healthcare than Germany does. And there's an interesting question there about how much we spend per head on healthcare, which is middling in Europe, versus what percentage of our GDP we spend on healthcare, which is quite high
Hmm.
compared to other countries in Europe, right? And people often talk about it as though both things are separate things. but they're quite related, right? Because the reason why our GDP, we spend a very high percentage of our GDP on healthcare is that our GDP is not growing very fast. The other countries have economies that are growing quite healthily. So, and obviously the reason why that's happening is that we have millions of people who are long-term sick. And politicians want to talk about it. You hear the Labour Party say this often, that we can only invest in our health, in our NHS when the economy is growing.
Yeah.
It should be the other way around. You cannot grow the economy if you don't invest in the NHS, because people need to be healthy in order to go back to work.
Yes.
Other
Yeah.
countries are able to invest, and we're saying you should invest and grow the economy.
Yeah. So the aim of this pledge, it's a specific pledge of 40 billion pounds more per year to catch up with equivalent European countries. But the aim of the pledge is to emphasise the need that if you do not have a fit and healthy workforce, that your economy is going to lag behind. As you've just noted, we are lagging behind.
Yeah.
Politicians often go on about GDP, but our GDP per capita has fallen behind
Yeah,
quite
I did
badly.
want to add that
Yeah,
another important element of the funding, obviously, I think, is that we've just lived through what I like to describe as 14 of the worst years in the history of the NHS, right? Today in the news, we're talking about rats and mice in NHS hospitals. Before that, we were talking about an NHS doctor who stepped into an elevator in the
yeah,
hospital.
yeah,
It malfunctioned and he broke his knee, right? And we're talking about having a backlog of repairs in the NHS of about 12 billion pounds.
yeah,
We're talking about hundreds of services being cut in the NHS. So we've lived through 14 of the worst, absolute worst years of the NHS's history, and we need investment to restore it to where it always was. It was the best system in the world in 2013 and 2014.
mm,
The model didn't suddenly fail. What failed was that it was not being funded properly. It's the best in the
yeah.
world when it's been funded properly.
Yeah, other points you made that are really valuable as well is so Labour will talk a lot about um, efficiencies. All politicians talk about efficiencies because if you ask a politician, look, this system is failing, this service is failing, you need a lot more investment. Oh, where's the money going to come from? Efficiency savings, and there will be some efficiency savings. But you've also made the point that if a patient needs a bed, then that bed needs to physically exist and it needs staffing. You still need a nurse for that. There may be, it's possible that there are some roles that a nurse or a doctor carries out that don't, strictly speaking, need the full training of a nurse or a doctor. Could be done by someone else or could be done by AI. But ultimately, you still need more doctors and nurses than we have, is the point. And also, something we didn't really talk about, but it's worth talking about, is we no longer, particularly in England, because you say it's devolved, we no longer really pay competitive salaries to doctors or nurses.
Absolutely. So I did want to kind of, obviously you mentioned the point about efficiency, and I'm going to
Mm,
come back to the doctors and nurses point. Is that the NHS is actually ranked among the most efficient healthcare systems in the world, right? Because we don't have like a health insurance model.
mm,
Health insurance itself requires hundreds of thousands of people to manage the insurance bit of it, not even the healthcare bit of it, right?
yeah,
And the US is an example of that, and obviously parts of Europe as well. And in many ways, we are, and what obviously you will hear the right-wing press talk a lot about NHS managers as being wasteful.
mm,
But the reality is that the NHS is a significantly undermanaged healthcare system as well. So, about the top management positions, I think, make up between 2 and 4% of the kind of NHS staff, depending on how you define top management.
yeah,
So
yeah,
it's quite important that we recognize that the NHS is already really, really efficient. And obviously, there can still be efficiencies found, but they cannot replace the fact that there are 10,000 doctors vacancies in the NHS right now. There are over 100,000 nurses vacancies in the NHS right now. We are middling to lower on the lower end of number of beds per thousand people in the country in Europe, right? The NHS requires literal physical investment to build it up
yeah,
so it's actually able to provide for people. None of that can be replaced by tech. Tech can do some things, and we absolutely need to implement a lot of that in the NHS in a way that works for the NHS and for patients. But none of that will replace building an NHS that's physically able to help with people.
sure. Um, And then the last pledge, the one that is my favourite, is ending outsourcing, bring services back in house as contracts end. So, I mean, we'd already talked about this as well before we started recording. And so, from my point of view, if the NHS needs to employ people to deliver any service at all, whether it be medical or ancillary or anything like that, if they're employing them all the time, or if they need their services all the time, it doesn't make sense to get a private contractor to deliver them, because the NHS can employ those people directly, can train them directly, can manage them directly. And when I talk about my personal experience, when I was very young, my mum was a nurse. Sometimes childcare was, she goes to work, I go with her. I was in the children's ward being looked after whoever was in the children's ward, playing with the toys there. And the hospitals were noticeably clean. It was a thing you noticed because it was much cleaner than your home. Whereas now when you go into hospital, they're dirtier than the home. When I stayed in a hospital for a few days a few years ago for elective surgery, I saw the private cleaning staff, just one member a day, came in for no more than 5 minutes with the floor buffer, stroked the floor for a little bit, not even under the beds, and off again. And that was it. And in 3 days in that ICU, I never once saw any what I would call cleaning. So that's the sort of thing. And you had an interesting take on that one yourself as well, didn't you?
Yes, so specifically on cleaning, and I'm going to talk a little bit more about privatization overall in the NHS, but on cleaning specifically, research, peer-reviewed academic research has actually shown, and it goes to kind of what you were able to illustrate with your personal experience there. The fact that hospitals that are cleaned by private companies, which are a lot of hospitals now, we see a lot of workers taking some kind of action because they want their jobs to be kind of insourced into the NHS. Um, Hospitals that are cleaned by private companies are far dirtier than hospitals that are cleaned by NHS staff or staff that are employed by the NHS. And obviously, the reason for that, and I think it's the New Economics Foundation carried out research, and some of the reasons for that are no training for staff. They're not providing sufficient equipment to staff. They're not providing sufficient cleaning supplies to staff. And obviously, when you privatize a service, um, the goal for a private company is to make as much profit as possible. And that means often cutting costs. And cutting costs entails cutting the number of staff, cutting how much you spend on supplies. And that ends up having a significant effect on the NHS budget itself. We're just talking about money. The fact that, according to this research, the NHS then spends, first of all, remember, private hospitals are dirtier and they lead to more hospital-acquired infections. The NHS then has to spend £1 billion a year, approximately, um, fixing hospital-acquired infections, right? So we supposedly kind of go private in order to save money, but at the end of the day, it's actually costing us far more to deal with this. And just to speak a little bit more generally about something that's actually happening right now, West Streeting has been talking about it a lot because we've been kind of putting pressure on him to be saying the right thing. The fact that the government is sending NHS patients to private hospitals to supposedly cut waiting lists. And obviously, you may have seen, the people who are viewing this may have seen the BBC Panorama documentary on Monday this week that found that some NHS patients who were sent to private hospitals for surgeries ended up dying because private hospitals don't have ICUs. And if you get a surgery in a private hospital and you have a complication, they have to transfer you to an NHS hospital. And sometimes, as a result of delays, and we know we have a crisis in the NHS, it takes so long to process that, to move you to an NHS hospital, and people have died in that process. We also know that almost 800 people who were sent by the NHS to private hospitals between 2018 and 2022 have then ended up suing those private hospitals for medical negligence. And guess what? Winning, right? That is 800 people, about almost 800 people. The specific number is 791 people won. That means not even those that sued. A great deal more would have sued and didn't win for some technical reason, right? So essentially, the reason for this, and brand new, quite last month, Oxford research showed when you outsource healthcare services, the quality of care for patients drop. The reason for that is staff, as I pointed out earlier as well, and the more serious cases tend to be sidelined by the private companies because they're quite expensive.
Yeah.
So essentially, privatization in the NHS leads to more harm to patients, costs the NHS more because it leads to private companies putting profits before patients.
Yeah. I mean, that's the same with any private service as opposed to one that's run by the state. You know, your major share, like if you're run entirely by the state, your major stakeholder is the Secretary of State for that department, and they're happy if the voters are happy, and as the voters are the customers, it's nice and symbiotic. Whereas if you're a private company, you have customers, but your most important
The
stakeholder are
shareholders.
your shareholders,
Hmm.
because they decide who gets to stay on the board and what bonuses are rewarded and all the rest of it. So yeah, all of a sudden the service is secondary at best. Absolutely.
A really good way to illustrate this, Sir Phil,
Yeah.
to illustrate this is the water problem that we are in at the moment, right? I'm sure you would have seen, um, ta water companies spilled over 2 or 3 billion liters of, oh, sorry, over 3 billion hours of sewage into our rivers and seas last year. And there's a very interesting way to look at that fact that shows you why privatization doesn't really work. Over a period of about 5 years, Ofwat, the regulator of water, and the Environment Agency fined water companies around 150 million pounds in fines for pouring sewage into our
Yeah.
rivers and seas. At that same time, the water companies were making about approximately 2 billion pounds a year in profits
Yeah.
taken together, right? So in essence, it's far more profitable for them to not
Yeah.
invest in the infrastructure to fix the sewage
Mm.
or to fix the leaks than it is for them to pour sewage into the rivers and seas, get fined, and
Yeah.
pay the fine,
Well, that's the
right?
thing. If the fine is cheaper than the cost of doing what you're supposed to do, then you'll take the fine as a business expense. Yeah.
Absolutely, yes.
Right, brilliant. So those are the pledges. You've explained them all really well. In terms of what you're hoping to do, is you want to get. There's two sides to this. There's the general election itself, trying to get a discussion going. So what you want to do is for as many candidates to sign up to, ideally all of these pledges, but at least one or more of these pledges, and then afterwards, particular emphasis would be on the candidates who become MPs to also raise these issues. I suppose a benefit of this as well is it helps raise awareness to any candidates who may not be conscious of some of these issues as well. So on your website, which I will have a link in the description below, there's a way for people to email their candidates. So what you've got, if you want to email, for example, a Labour candidate, if you open that up, you can find your candidate for your constituency. Your constituency may have changed because of boundary changes, and you'd be able to click on that and send an email as
So
well.
just to explain that
Yeah.
a little bit, because it's so much easier than that. You click on the link that Phil is going to put in the chat. You get to the page. Um, what you need to do is put in your postcode. The moment you put in your postcode, what that does is it finds your constituency and it finds the candidates in your constituency, right? So you don't actually need to know who they are or find them. It finds it up for you. It pulls it up for you. At the moment, not all candidates have been selected.
Mm.
So in what we have done is that where if your Labour candidate has not been selected, your email goes to West Streeting, who is the shadow
Right.
health secretary, right? If your Tory candidate has not been chosen, your email goes to Victoria Atkins, who is the health minister, health secretary, right? But overall, the idea is it pulls up your candidates and it also has a prepared letter that we have written. You can edit it, make it suitable for yourself, or you could decide to leave it. It could take you 2 minutes in total
Yeah.
to do this process. You click and send off your email to that. We hope that we can mobilize thousands of people in each constituency to take action and demand that their candidates take the pledge. And then, obviously, as you say, after the election, what we would like to do is to go to MPs or people who took the pledge, who ended up as MPs, to say, You took the pledge, you promised that you're going to support investing £40 billion more into the NHS, ending NHS outsourcing, reinstating the health secretary's legal duty to provide healthcare. What are you going to do about it now that you're an MP?
Yeah, sure. Brilliant. Okay, well, thanks very much then. So like I say, the links are in the description below if you'd like to raise this with your local candidates. No reason you can't contact all of them if you'd like. Personally, I think the main benefit here is that by writing to your candidates, you're not just letting them know where you stand as a potential voter, but you'll be raising awareness of those issues. As I also said, don't imagine many candidates really understand the issues that the NHS has. Yes, they'll probably know it's on its knees, and they'll probably know it's because the Tories have caused it real damage with their ideological obsession with privatising it. But the more MPs that understand some of the core issues, the more likely they can give a steer to solutions more likely to work. But there we are. Those are my thoughts. If you enjoyed the video, please subscribe for further content and click the like button. You can also sign up for memberships if you'd like to support the channel further. Thanks for watching, and until next time, I'll see you later.